Hi everyone, this is Dr. Stefan. In this video, I'd like to go to the basics. What are the most common symptoms of lung disease? Because a lot of people may be struggling with different things and they may wonder how to integrate what they're feeling into, is this a condition? So I'm going to just mention some of the more common symptoms, but first I'd like to say that if you are struggling with any symptoms, if you're having any health problems that you're worried about, the best thing is always to go seek some advice from a medical professional in your area. It's very hard to find the right information online, so always it's best to just consult with someone who can actually see you. And obviously, me being a doctor on the internet is probably not enough in most situations. But that being said, let me tell you a little bit about lung disease. So lung disease can be very diverse. There can be a lot of things that could be affecting the lungs. But most of the symptoms that people experience are non-specific to to one condition. So you may have some of these symptoms, but they could represent a number of things. So this is why I was telling you at the beginning that if you have some of these symptoms, it could be a number of things. It could be something less concerning, more concerning. It depends on the case. It depends on your age. It depends on your medical history, what you've been exposed to, what are your predispositions. The main symptoms that people experience when they do develop something related to their lungs or airways are the following: shortness of breath, wheezing, coughing that doesn't go away, your chest being tight, producing mucus, bringing up more phlegm than usual, maybe chest pain in some instances. But as you can imagine, these are very, very diverse symptoms. So let me just talk a little bit about every one of them, just to tell you what they may represent. And again, take this with a grain of salt, pinch of salt, whatever you want to call it, because it may be a different thing in your situation. It's always quite hard to understand. But hopefully this provides you with some idea. So people being breathless. What is being breathless actually that's significant? So this is where we need to think about whether we're looking for a condition or we're dealing with a situation which you might be breathless anyway. So for example, someone who's going to work in an office, sat at their desk all day, driving to work, driving to the supermarket, not really moving too much. When they try to get out of that habit, they will feel breathless and they may consider that they're really, really unwell, when it could just be an element of deconditioning. This could also happen to people who have been hospitalized for a different reason. And when they're trying to recover, they've lost muscle mass and they can be breathless for that reason. So this is the first thing that we need to think about. But obviously, if you are, for example, struggling to keep up with people of your same age group, same age range, you're walking with a friend in the park and you feel you're really getting breathless, but they are not, this is a good indicator that there may be something going on. And then the shortness of breath could be related to a lung disease, a heart disease, anemia. It could be a number of explanations for why you might be breathless. But a significant level of breathlessness would be when you are actually struggling to do things that you were doing maybe a year ago, or when you're comparing yourself to someone of your own age. So this is a good indicator that you are breathless on exertion more so than usual. And don't always put it down to age. So if you're in your 50s, 60s, and you're suddenly more breathless, I don't know if that's not something that you might be worth investigating. Now, if you're having wheezing, so maybe your breathing makes a sound. When you're trying to breathe out, your breathing goes a bit like, whoo, something like that. I don't know if that reproduces the sound. That would be a wheeze. We call that a wheeze. It's like a whistling sound. So that could be a symptom of asthma, for example, or it could be a symptom of another airways disease such as COPD. Now, people who have asthma generally also have chest tightness at the same time. So when they have the wheeze, they may feel that their chest is really going tight and they're trying to breathe out, but it's as if there's a blockage there. So this could be a sign that maybe there's asthma going on. But there are usually other symptoms associated. So generally when people get lung disease, they get a combination of symptoms. They don't just get the one. So if you're having this wheeze and chest tightness and you're breathless, if it comes and goes, from one day is better than the other, you might have episodes, attacks, that could be consistent with asthma. If that's more continuous, so you're having that most days, and again, maybe when you're coughing, you're bringing up some phlegm, you know that you've smoked for a bit, you're maybe after the age of 40, 50, that could be more consistent with COPD, chronic obstructive pulmonary disease, or emphysema, or things like that. So again, it depends on the context a lot. Now, chronic cough. So when we're talking about a cough that's really something to worry about, we're generally talking about a cough that doesn't go away. And people may have mentioned to you that you've been coughing for a long time. So if that's the case, it's always good to maybe seek a little bit of advice from a medical professional, especially if there's a cough that's been ongoing for maybe more than 6 to 8 weeks. So sometimes you may get a viral infection, a chest infection, bronchitis, you get a virus from someone, and you have that episode when you have the cold, the flu, whatever, and you still have a cough that goes on for a bit. Now, it's fairly expected that that cough will be going on for maybe, a month, maybe up to 6 weeks, 8 weeks. But if it's more than that, the cough's not going away, if it's actually getting worse, not improving, if there are other symptoms that are bothering you besides the coughing, there's breathlessness that's out of keeping with everything else that's going on. If there's things like that, if you're coughing up a lot more phlegm, you're bringing up a lot of phlegm with your cough, and it's green, it's ugly, there's something going on there. If there's blood when you're coughing up the phlegm, those are things that should make you wonder whether there's anything going on in the lungs. And it's not always all bad, very, very bad conditions. It's just something that should make you wonder about checking what's going on. So these would be kind of things that would be making me think that there is lung disease. But like I said, all these symptoms are non-specific. They generally do not come just one at a time, and not one symptom will explain all the conditions that could be there. The best thing to do is to check with your doctor, take it step by step, have some basic investigations if you need to, and then see what's going on step by step. Cross every bridge as you're coming to it, but always looking out for your health earlier is better than postponing it too long. Hopefully this was helpful and at least reassuring in some way that there is help out there. So please go and seek it. Thank you very much for watching. All the best and good health.